And this is a second part of our interview.
Okay.
And let me proceed with our questions. And next question, actually we were very close to finish your career journey. And what the most favorite product which you sold in the past, and how it was, and why this product was your favorite one?
I had the most fun selling cardiovascular ultrasound for Philips. And the reason being, I just think the biggest thing is one of the products we launched while doing this was a transesophageal echo probe that could view in 3D, live 3D. So it was the first time a surgeon could see the valves inside the heart flipping around from all different areas, all different sides and dimensions, and they could get a very accurate understanding of what's going on in the heart before they even crack the patient's chest. So it gave them a preview of what they needed to fix prior to them even touching the patient.
Got it. Thank you so much. And our next questions will be related for the heart attack. And what do you think about heart attack problem? Why do so many people have problem with heart?
Genetic. Number one is just, it's just bad. It's genetics. And I think number one is it's genetics. Number two is just especially in America, you know, we're the most obese, laziest country, and and we smoke. Okay, so interesting thing. So I'll reverse that. Smoking, if you're a smoker and you die of lung cancer, you actually beat the odds. Most people that are heavy smokers die of heart disease before the cancer takes over and kills them. So that's how devastating smoking is to the heart. Number two, if you're not taking care of yourself, if you don't have the mentality, the culture, the drive in yourself to get out, work out, you know, and you don't have to be running a marathon, right? But keep yourself fit. You know, you're a thin guy, I'm a thin guy, and you know, take care of yourself, right? Eat well, get the right amount of rest, get some workouts in. All those things can be managed, and a lot of people don't do it. They're just fast food junkies, right? But the reality of all of this is it's genetic. You know, we have people that genetically have histories and histories in their family tree of heart disease and high cholesterol, and those things all, you know, they wear out the heart.
Okay, and what do you think? What product will be better to sell, right, to prevent all these issues which you mentioned before? Maybe not specific, but maybe some characteristics of this product. What do you think?
I think we got a lot of them covered right now. I think, you know, the pharmaceutical products help. They help keep blood pressure down. They help keep cholesterol down. And so I definitely am. I am a fan of medical treatment. I think we have the best and brightest physicians and companies working on the newest, the latest and greatest devices. You know, whether it's a heart valve. Today, we're popping them into people's chests without even cracking their chest, right? We're going through the groin. So I think we're doing better. I think those things just need to keep evolving. And just the more, and then I think the more people try to improve their lifestyle will help. But it's, you know, we're always going to be chasing that wheel. It's I don't think it's ever going to end.
Okay, and you touched this very interesting device area. What do you think? What the place of technology in solving this? Maybe not only heart attack problem. General, is it helpful for the medical world, or this only the super expensive gadgets which work in some specific cases, but it's not related to the population when the people, you know. Nation you mentioned about obesity in the United States, a whole nation has a problem with obesity. What do you think? What's the place of technology? for solving this problem? Yeah.
Well, I mean, again, some of the biggest problems are just our diet and exercise, right?
Yeah.
So, are there gadgets that can help people get out and about and do more of these things? There probably will be. But in I guess technology, as far as I think you're going to see an advancement in data collection and in what we'd call like artificial intelligence and tracking. I think we need to do a better job of probably tracking patients and making them more compliant. You know, one of the big issues with heart attacks and heart diseases, people aren't compliant on their meds. They're not compliant on what their doctors are telling them to do to take better care of themselves. So patient compliance is an issue. If we could increase that, I think it would help. Stress levels, that has a big effect on it. How do we maybe one of the things technology could be a really negative is people are addicted and stuck to their smartphones, right? That
Yeah,
causes stress. Stress
absolutely.
causes
Yeah.
heart disease. So sometimes we're overstimulated. But I think you're gonna start seeing a lot more data collected on going back to genetics, right? The family tree. You know, did you get it? Did you get a scope done? Like, you know, did you go, what do you call it, like a prostate exam and those things earlier in your life rather than waiting until you're 65, 70 and it's you know, it's too late? And are you seeing a cardiologist at the right time? And how often are you seeing that cardiologist? You know, I think that can improve heart care. And then I think you got to also start attacking it in the rural areas, right? And maybe
Yeah.
technology can help with that. Is how do we better monitor, you know, people that are living in very, very rural parts of America or other parts of the country?
In other words, technology could be advantage, but
Yes.
in the same time, it could be disadvantage when we're talking about addiction, I don't know, increase in stress levels, whatever.
Correct.
And what do you think will be in 25 years in the future with all this technology, cool stuff, devices? How this problem will be solved? I mean, heart attack problem, or this will be the same level as we have 25 years ago? What do you think?
I think you'll see an increase in it just because there's more people in the world, right? But I think percentage wise, maybe we could shrink that with technology.
Mm-hmm. Mm-hmm. Okay. I agree with you, but actually it's very difficult to predict what will be in the future, because, you know, as you mentioned, on the one hand, it could be advantage, you know, some, I don't know, cool applications, fitness applications, which new generation will use for the good purposes. At the same time, we will have, I don't know, more addictive advertisement, more addictive TV shows and smartphones and all stuff related to this. And it depends only a person what and how person will use technology. And yeah, what do you think for the problem of heart attack in the future? What product will be better for the hospitals? I know that you sold a lot of them and related from different areas, but probably you have some, you notice some, I don't know, lack of demand, or I don't know, lack of equipment of the hospitals. What do you think? What the hospitals need actually to more effective solve problem of heart attack?
Well, heart attack in general, we need to do a better job of number one is the best medicine is reactive, right? It's a proactive, right? And that goes down to diet and exercise. If we get people to take care of themselves better, we're all right. If we get people to pay more attention to their current history and their issues, we can catch things earlier. The key is, again, catching things early. But maybe if we can increase communication amongst like the EMS programs, right? The ambulances out there picking a patient up, picking someone and bringing them to a hospital. and maybe we do a better job with what do we call it? Logistically moving these people and getting them into the better hands quicker, right? A stroke center or a heart center sooner, quicker. There's certain meds we can get on board with these patients to help them if they're having a heart attack. So I think those things, can we expedite what we treat them with and where we get them? I think that could improve outcomes. And then sometimes that also leads to surgeries, right? So maybe getting the troubled patient to the right facility sooner is going to help. And that can be done by better technology amongst ambulances, amongst the communication. And I think that's where you're going to see a lot of this analytics and this, what we'd call it, AI assisted devices.
Very interesting thought. Yeah.
People are communicating on that. A team of people are communicating about that patient throughout their whole continuum of care. I think that's where you'll see technology improve.
Mm-hmm. Yeah, thank you so much for sharing this. Actually, we are very close to finishing our interview, and last question will be, and we touch a little bit this COVID and influence of the COVID. What do you think? How COVID influence not only the sales, how COVID influenced the hospital and medical system in general, or probably nothing changed and the medical system, healthcare system still in the same state, and they not change a lot. What do you think? Is it COVID make this change or not? And
I think COVID has been a big eye opener to everyone that is concerned with healthcare, whether it's a hospital or whether it's people out and about on the streets. And I don't think it's going to go back. I think we realized we were unprepared for something like this. I think the hospitals are also, years ago, hospitals in their buying groups, they did like more of a leaner, thinner approach, right? And that's why you saw all these issues with masks and PPE stuff, is because these hospitals weren't buying as much because they thought, oh, if we have less on the shelves, we're saving money, right? Yeah. So I think that caught us off guard. I also think that a lot of our biggest issues with COVID were that a lot of this stuff is not made in the States. And I think you're still seeing that, as a lot of the stuff, even the pharmaceutical products, even the generic parts that go into the pharmaceutical products, were all stuck in China. And I think, and because of it, they weren't ramping up. And then when they started to ramp up, it was still too late. And now the stuff's stuck in ships and containers, right? I think that's one of the biggest issues. The other biggest issue we have, I don't know, is the reality that it became a political mess, right? Regardless in the States of whether you're a Trump fan or a Biden fan or a conservative or a Republican or a Democrat, you have people out there that don't want to get vaccinated. And if you look at the hospitals right now, 90% of the patients the hospitals are full again. And 90% of the patients that are in these hospitals today are unvaccinated patients. So we had a huge issue that this became a political mess. And so I believe everyone should be getting vaccinated. Okay. And the joke of this is, and we can kind of joke about it, but goes back to people taking care of themselves, right? You got someone that's been eating McDonald's for the last 20 years and they're obese and they don't care. But now they're worried about putting a vaccine. What's in that? We don't know yet. It hasn't been out long enough. It's like, well, you didn't know it was in that Big Mac for the last 20 years you've been eating. So people are just, the mentality of people is so messed up that we got to get over that hurdle of people need to be vaccinated. I think moving forward, you're going to see the COVID shot will just be like the flu shot in the States, right? They're going to recommend everyone get it every year. It's going to be a different variant to it. And hopefully then if you were vaccinated and you get COVID, it's much more milder symptoms, right? I think that's what's going to happen. But I also think one of the reasons we have a huge staffing problem is people that say had a middle to low end job in a hospital system that were making $15 to $20 an hour. We're like, why do I want to go work in a stressful hospital and do those things when I could go do that now in a manufacturing facility and make that money. Okay. So a lot of people are staying away from hospital employee work because of COVID. They're worried and scared, right?
Yeah. Thank you. Thanks a lot for all your thoughts related to the COVID. Actually, thank you so much for all your interview, because this was super interesting, and we touch a very broad amount of different topics in sales, in cardiology, in relationship with hospitals, with insurance company. And Kevin, huge thanks. And I'm sure that we all together will collaborate in the future. Okay. And I believe that you will help us in some way for our, maybe not only one product, for different products. Thank you so much for sharing your expertise, and thank you. Thank you.
Okay.
Okay, and we are finishing, and